Hello everyone, this video is about pulmonary hypertension. Definition: an elevation in pulmonary vascular pressure that can be caused by an isolated increase in pulmonary arterial pressure, by increase in both pulmonary arterial and pulmonary venous pressure. In practice, pulmonary hypertension is used for pulmonary arterial hypertension and is defined as arresting mean pulmonary arterial pressure greater than 25 mm of Hg, arresting systolic pulmonary artery pressure greater than 40 mm of Hg. Etiology and classification: pulmonary arterial hypertension, sporadic, familial, related to collagen vascular disease, liver cirrhosis, HIV infection, congenital systemic to pulmonary shunts, associated with significant venous capillary involvement, pulmonary veno-occlusive disease, pulmonary venous hypertension, left-sided atrial ventricular heart disease, left-sided valvular heart disease. Pulmonary hypertension associated with hypoxemia, COPD, interstitial lung disease, obstructive sleep apnea, pulmonary hypertension due to chronic thrombotic embolic disease, thromboembolism to proximal pulmonary arteries, obstruction of distal pulmonary arteries in pulmonary embolism, sickle cell disease, miscellaneous sporadic histiocytes, pathophysiology. Normal pulmonary artery systolic pressure at rest is 18 to 25 mm of Hg with a mean of 12 to 16 mm of Hg. This low pressure is due to large cross-sectional area of pulmonary circulation, which results in low resistance, increase in pulmonary vascular resistance, increase in pulmonary blood flow. Clinical features: symptoms of pulmonary hypertension and its consequences: fatigue, dyspnea, syncope, angina due to reduced cardiac output, hemoptysis uncommon and occur due to rupture of distended pulmonary vessels, peripheral edema, tender hepatomegaly, raised regular venous pressure due to right ventricular failure. Signs of pulmonary hypertension: cyanosis, peripheral cyanosis due to reduced cardiac output and skin blood flow. Pulse is low volume due to reduced cardiac output and left ventricular stroke volume. JVP: prominent A waves, JVP elevated with the right ventricular failure, prominent V waves and rapid Y descent with functional TR. Inspection and palpation: apical impulse may be shifted, indicated right ventricular hypertrophy and dilation, visible and palpable left parasternal having epigastric pulsation indicating right ventricular hypertrophy, palpable P2. Auscultation: pulmonary ejection sound, abnormal S2, right atrial fourth heart sound S4, right ventricular third heart sound S3. Pulmonary ejection systole murmur, pulmonary early diastolic murmur, tricuspid pansystolic murmur. Investigation: ECG, right axis deviation, right atrial enlargement, right ventricular hypertrophy, chest X-ray, enlargement of pulmonary trunk and its main branches, peripheral proving of vascular shadows, enlarged right atrium, enlarged right ventricular, echocardiography. Other routine autoantibodies if collagen vascular disease, HIV ELISA, atrial blood gas to exclude hypoxia acidosis. Sleep studies: helical CT, high resolution chest CT, cardiac catheterization. Treatment: directed early recognition and treatment of underlying cause. Pulmonary enterectomy is currently mainstay of chronic thromboembolic pulmonary hypertension. Treatment of hypoxemia by low flow oxygen. The excessive diuretics avoided. Drugs like iloprost,